Hello, I'm Patricia Henderson with Senior Connection Center, and this is your weekly connection. Today's topic is Parkinson's disease. Many of us know about Parkinson's disease because of the actor Michael J. Fox and his experience, or we may have a loved one who's experienced the disease. According to the Parkinson's Foundation, there are almost 1 million Americans who suffer from Parkinson's disease, and about 60,000 Americans are diagnosed with Parkinson's disease each year. Worldwide, about 10 million individuals are living with Parkinson's disease. The economic impact of Parkinson's disease in the United States is about $52 billion a year. To help us learn more about Parkinson's disease, we have joining us today Ginny Wolfe, community educator with Senior Helpers of Lakeland. She is also a facilitator for Parkinson's disease support groups. Also joining us is Chelsea Dooley. She is a senior care advisor for the Neuro Foundation for Parkinson's. Thank you both for joining me today.
Thanks for inviting us.
Chelsea, will you tell us a little more about Parkinson's disease? What is it?
Absolutely. Thank you, Patricia, again for having me here today. Parkinson's disease is a degenerative brain condition, which is also progressive. It is marked by a lack of dopamine-producing cells in the body. Typically, about 80% of those cells are gone by the time somebody starts experiencing Parkinson's disease. It also has many ways to be treated, many things that people can do when they're fighting Parkinson's disease. But overall, yes, it is a progressive degenerative disease of the brain.
Ginny, are there indicators that when people see them or notice changes, that they may want to take their concerns to their primary care provider?
Sure. Probably the first thing that people notice, or the one that most people associate with Parkinson's disease, is a tremor. Usually and I'll try to sort of a rolling tremor, frequently in the hand. Sometimes it's just a finger, sometimes it's toes. It really varies from person to person. But there are also things like postural instability, things like rigidity. People think that sometimes is just arthritis because they have rigidity in their joints, and it's sort of a ratchetiness when they move their knees or their elbows, things like that. Also bradykinesia, which is slowed movement. And so those are the 4 motor symptoms that people normally see that's their first indicator. But there are also some non-motor symptoms that people don't think of as being a part of Parkinson's disease. One thing that we've discovered is that a lot of people with Parkinson's disease have a diminished sense of smell. And sometimes that has started years before some of the motor symptoms come on. I think it's something right now with COVID-19, people are thinking, okay, is the lack of sense of smell something to do with COVID? Is it Parkinson's? Is it something entirely different? But that's one that people just don't ever think about. But I would say that in my support group, probably at least 60 to 70% of the people that I talk to with Parkinson's say that they have a diminished sense of smell. There are other things that aren't just with Parkinson's, but happen with a lot of other diseases, things like depression and anxiety. And it's like, how much of that is Parkinson's? How much of it is their personality? How much of it is other factors going on in their life? But probably the 4 motor symptoms are the main indicators that people have. And that's when they go to the doctor to talk about Parkinson's. But the tremor is probably the one most common indicator that people have. But like I said, it's not there with everybody with Parkinson's. And it's not always, we think of the tremor in the hand, but it can be, I know one person who his tremor is in his lip. So it just really is variable. It's one of those things that people have said, if you've seen one person with Parkinson's, you've seen one person with Parkinson's, because it is so varied in the various people that have it.
You mentioned postural instability.
Mm-hmm.
What do you mean by that?
People who, sometimes it's having difficulty getting from a sitting to a standing position, or then when you are standing, that inability to keep your balance. There's a lot of balance issues with people, or then once you are standing, the inability to actually start walking. I mean, most of us, you stand up from a chair, you don't even think about it. You just stand up, you get up, you move. With people with Parkinson's, there's a lot of instability. And again, people think, okay, it's just age, I'm just getting old. One of the issues with Parkinson's is frequently problems with orthostatic blood pressure, or having a low blood pressure, a drop in blood pressure. And we've all had that feeling of you stand up too quickly and all of a sudden you go, oh, I stood up too quick and I'm a little bit dizzy. But people with Parkinson's have that quite frequently. And so, and I know we'll talk later about some of the things you can do as treatment, but that's one of the reasons with that instability that people need to consider exercise, and particularly exercises that help your balance. Things like dancing and Tai Chi and boxing and some of those things are really helpful, because it's just that instability to keep your balance and just being unstable when they try to get up, but walking, get moving, things like that.
So once someone has been diagnosed as having Parkinson's disease, what are some of the ways the disease is treated? Chelsea?
Yes, thank you. There are several ways to treat Parkinson's disease. The most common are medications for Parkinson's disease. Most of the time, people are going to want to seek out the treatment of a movement disorder specialist, who is a neurologist with an additional 2 years fellowship training in movement disorders, with Parkinson's being the top movement disorder. So typically, the movement disorder specialist will make the diagnosis based on ruling out other diagnoses, other issues the person may be having, watch the person walk, move, etc. And once that diagnosis is made, typically they will start them on a variety of different medications. Most of them are treating the dopamine in the brain, which is what the Parkinson's disease neuron, or part of the brain that has been affected by the Parkinson's disease. So the medications are kind of the staple, the mainstay. But as Ginny mentioned, there are several other issues come up with Parkinson's disease, with balance, with gait, with the non-motor symptoms that are all very treatable with things like physical therapy, speech therapy. There's actually a Parkinson's specific speech therapy and physical therapy called LSVT. Big is for movement, which quite literally means they're making large movements in an attempt to retrain the brain circuitry, because Parkinson's makes everything small. Makes the steps small, handwriting small, also makes the voice small. So when people come to me as a care advisor asking what they can do, yes, the medication's important, but things like the therapies are also very, very important. Also with the speech therapy, it's not just the voice getting quiet, it's also swallowing. That can be a major issue for people with Parkinson's disease. And so getting those therapies done as soon as possible is really important for folks with Parkinson's. There are also treatments that, as later stages come up, someone can consider with consultation from their movement disorder specialist. There are some surgical options, deep brain stimulation, but really the medication, the treatments of the therapies, speech, physical therapy, and also Ginny mentioned some of the non-motor symptoms like depression and anxiety are often not talked about as much. And the person who is fighting Parkinson's disease may have some mental health issues as well that need treatment. So it's very important to have kind of a multifaceted way of treating Parkinson's disease, even though medication is most commonly prescribed when the person is diagnosed.
Ginny, are there ways to slow the progression of the disease?
Most of the medications will help with the symptoms, but the disease is progressive and the brain cells are continually depleting. So while things may slow down a bit, the simple fact is that things are always going to progress and it's going to get worse. But particularly things like the physical therapy, or things like exercise like dancing, Tai Chi, boxing, some of those really can help with balance. And while it might not slow the progression of the disease, it can certainly help with symptom abatement and making people have a more productive, happy life.
Well, and there are also studies that have shown that exercise, like you were saying, Ginny, is the only known thing to slow progression of symptoms. Absolutely.
Yes.
Yeah. But to echo what Ginny was saying about the importance of movement and exercise, there are some great Parkinson specific exercises. Again, like Ginny mentioned, boxing, the dancing, Tai Chi. Those are all very, very helpful for symptom management. And then, of course, really being the only thing that can possibly slow the progression along with treating the symptoms.
I know during COVID-19, support groups have changed. Ginny, are there still support groups available in Polk County?
Yes, there are. I facilitate a support group, or have facilitated for about 8 years, a support group in Lakeland. We have not met in person since March, since the beginning of the pandemic. However, we are now meeting via email. So once or twice a month, I share with them resources that I have come up with or found. So whereas we used to have speakers come in and talk about different topics, now I'm sharing those organizations' information via email. There's also a support group that meets in the Lake Ashton area, so between Winter Haven and Lake Wales. They have just started meeting via Zoom after not meeting in person since March. And there's also a support group that meets in the Sola Vita community in Poinciana. And I will share with you information on how to get a hold of those other 2 support groups as well. I can share with you the emails of the facilitators of those 2 groups. But yes, we still provide support. We're just doing it a bit differently now with the advent of coronavirus.
And we will have those email addresses and links for the support groups in Polk County available for you at the end of the video, as well as other links and phone numbers that are mentioned. Chelsea, I know Neuro Challenge has gone virtual with everything. So can you tell us a little bit more about some of the support groups or programs that are provided through Neuro Challenge?
Absolutely. And yes, we have gone virtual as of April. A little bit just a background about Neuro Challenge. Although we are based in Sarasota, when we are back in normal time frame, our geography, we cover Charlotte County, Sarasota County, Manatee County, Pinellas County, Marion County, and Highlands County. With the event of COVID-19 and going virtual, one of the few silver linings is that we are seeing people from all different counties in Florida, as well as other states and even other countries. So it's nice today to be able to connect with Ginny. There are support groups all over the place that we can help steer people to when they're back in person. And then we can also be a resource to those folks who are not in our 6 counties that we typically serve during these times. So yes, we have over 40 groups that we do monthly. They are support groups, both for, we call them our care partners, and our power hours for people with Parkinson's. We have those on Thursdays. We have many education programs. We have therapeutic programs like dance and ballet, yoga, meditation. We have all different types of programs that we offer, wellness programs, education, and all of those programs are free of charge for those who attend.
Great.
And we'll have the link for their website so you can find out more about the programs they have available at the end of the video. Now, Chelsea, you mentioned care partners. And I would like for both of you to weigh in on this. What should caregivers know or care partners know about caring for someone with Parkinson's disease? Ginny?
I guess my first thing is have patience. Have patience with yourself and have patience with the person with Parkinson's. The person with Parkinson's can't help the fact that they have a tremor. They can't help the fact that they're unstable in terms of their posture. There was someone in one of my support groups who used to get very frustrated because she said anytime she and her husband would go out to dinner, she would always have to make sure that they sat in a booth and sat in a place where when he sort of tilted to one side or started to fall, that he'd fall towards the back side of the booth and not out onto the restaurant floor. And she was like, he just doesn't pay attention and doesn't sit up straight. And it's like, no, that instability is part of the disease. And it's like, even though he'd had Parkinson's for a number of years, she was like, I had no idea. So having patience with your partner, having patience with yourself, you're going to get tired, you're going to get cranky, you're going to be overwhelmed sometimes, but know that your partner can't help the fact that all of a sudden they have urinary frequency that they can't hold it without running to the bathroom. But it's like knowing that that's just part of the disease, knowing that when you're walking down the sidewalk with them, maybe you don't have conversations with people like you do normally, because the person with Parkinson's needs to focus on where they're walking and what they're doing and not on what you're saying to them. One of the things we recommend for people with Parkinson's is putting tape on the floor, like a bright yellow, like masking tape, but in bright yellow, because that way people know to step up and lift their feet and not shuffle so much when they walk. Little things that they can do that a lot of times people haven't even thought about some of those things. It's like people don't shuffle their feet because they want to. It's like the brain isn't telling them to pick up their feet, and the instability is such that they just simply can't do it on their own. The other thing is seek out support, whether it's a support group like mine, whether it's a company like Chelsea's, whether it's going on the Michael J. Fox website. They do what's called a Third Thursday webinar every month. It's free for people to do. Plus, they've got an archive of, I think, probably about 5 years worth of their webinars that cover topics that go anywhere from the latest in medications to the need for exercise, to one of the big ones just a couple months ago that they did was medical marijuana and what that can or can't do for people with Parkinson's. There are other foundations out there, but like I said, the resources are there. There are Facebook support groups for people right now that I can't even begin to tell you. Just, when you're on Facebook, type in Parkinson's support and you will find a dozen or more Facebook groups that come up. So there are resources out there, but you have to be your own advocate. When it's you with Parkinson's or whether it's your loved one with Parkinson's, talk to your doctor. If you're not getting the answers you need from your family practice doctor or your neurologist, the other thing Chelsea said is finding somebody who's a movement disorder specialist. There aren't many of them out there, but that's important because a lot of doctors, well, they're great doctors and they might even be great neurologists, are not all that well versed on Parkinson's disease. And so that's one of the keys, and it's one of the challenges for people in Polk County right now, because we really don't have many doctors here who focus on Parkinson's disease. So that's one of the things that I would say is definitely you have to look for the answers. People are not just going to magically fall from the sky and give you information. You have to seek it out yourself.
Those are good tips for caregivers. Find information and be patient. Chelsea, do you have additional thoughts for caregivers?
Yes, absolutely. And again, I echo what Ginny says. It is so important to find a support group in your area. It really is a partnership. And the reason why we refer to caregivers as care partners is because it's not just the person with Parkinson's that has Parkinson's. Mm-hmm. It's the partnership. And oftentimes that is a spouse, but it may not be. It may be an adult child. It may be a best friend. It may be a paid caregiver. It may be a network of people who are assisting with care. So it is so important for both individuals, the care partner and the person with Parkinson's, to get information. And oftentimes we hear from our care partners that it's not necessarily the physical symptoms that are the biggest challenge to deal with. It's the non-motor symptoms. So having an understanding of Parkinson's disease, that it may take your person with Parkinson's longer to form the answer to a question, that you can't multitask. If they're watching TV and you ask them a question and they don't answer, they're not ignoring you. They can't necessarily focus on two things at once. So again, like Ginny said, patience is key. We know that that's a challenge. We're all human. And so certainly care partners are going to feel frustrated and challenged at times, but stress exacerbates symptoms for people with Parkinson's. So it's very important for the care partner to seek that support to help manage the stress in their own life so that they can help the person that they love with Parkinson's disease.
Well, and it comes to mind that another non-motor symptom that we see in people with Parkinson's is people having hallucinations, seeing things that aren't there. And that's another one where people just need to be patient with the person with Parkinson's, because just because somebody isn't there physically doesn't mean that in the brain of that person with Parkinson's, they aren't there. A quick story, there's somebody that I know with Parkinson's who he would see people in their backyard. And the wife, his care partner, would say, at first when this would happen, she'd say, go and look, she'd go look out the window and say, oh, Joe, there isn't anybody out there. What are you talking about? And she finally realized that to him, those people in their backyard were very real. So she finally asked him, well, Joe, what are the people in our yard doing? And his answer was, well, they're just sitting in the swing. And she finally said, you know, we've got a nice backyard. How about we just let them sit in the swing and enjoy it? And in a few minutes, I bet they'll go. And 10 minutes later, he'd go, yeah, they're gone. And so it's like, as a care partner, you just have to learn to go with the flow on some of those things. The problem is when those hallucinations then turn into delusions and people are worried about somebody causing them harm, or they have a false belief about that. And in this particular case, he did reach the point where then he was worried that the next door neighbor was out to get him, in his words. And she was like, we've lived next to this person for like 15 years. We've never had a problem. We're not best friends, but there have never, ever been any issues. And her husband just knew that this guy was out to get him in some way. And she said she finally learned that she closed all the blinds on that side of the house. So he couldn't see out, he couldn't see the house. Therefore, it didn't trigger that particular delusion if he didn't see the house. But yeah, care partners just sometimes need to learn new ways to cope with things that you never thought you would have to cope with before. And those are the kinds of things people never think about, hallucinations or delusions being a part of Parkinson's, but they are. Constipation is a big issue. And so people are like, how do I deal with my husband who has constipation all the time? And it's like, okay, so you have more fiber and you do all of these things, more fluids, but then that causes more urinary frequency. And so how do you balance that out? Because then it's like, don't drink too many fluids because that way you don't have to go to the bathroom all the time. So as a care partner, you just have to face that these are some of the issues that happen. And like I said, to me, the biggest key for a care partner is patience.
Patience, understanding, and information.
Nobody wants to have Parkinson's. Nobody, at some point said, hey, let's all stand in a line and who wants to have Parkinson's, and I'll raise my hand that I want to get Parkinson's. That's not how it works. So yeah, the person with Parkinson's doesn't want it either. You don't want to be the one as a caregiver to deal with it sometimes. But yeah, trust me, nobody with Parkinson's said, please let me be the one that gets Parkinson's.
Such good information today on such an important topic. Jenny and Chelsea, thank you both for being here today. Final thoughts for us, Jenny?
Thank you for sharing this information. If you have Parkinson's, don't be afraid to ask questions. Seek out the medical help that you need. And like I said, one of the keys is finding the right doctor, not just a family practice doctor. They're great doctors, but they're not specialists in Parkinson's, not even just a neurologist. Find somebody whose focus is movement disorders is probably my biggest piece of advice, because that's something you're definitely going to need. They're the ones who have the knowledge. They're the ones who really have your back, so to speak.
Chelsea, final thoughts for us?
Yes, and thank you again, Patricia, for having me here today. Yes, I again echo Ginny about the importance of a proper treatment team. The movement disorder specialist, also the therapists that can work with you. Mm-hmm. Additionally, the support team of support groups, resource referrals, we can provide those to people, and again, completely free of charge. So there's a lot of things about Parkinson's that people may not know. So knowledge is power. There are so many things that crop up along the way. For some people, it's even getting the proper diagnosis in the first place. One thing we didn't talk about earlier was the Parkinson-isms. We get a lot of questions about those. And so for anyone out there watching, please know that we're available to help. You don't have to have the specific Parkinson's diagnosis. There are other diagnoses like Lewy body dementia, multiple systems atrophy, et cetera, where someone does experience the symptoms of Parkinson's, and that can also be a challenge to manage. So we are here, Ginny's here. There are great people out there who can offer you support, who can offer you answers to questions, because it really is a journey. Many people with Parkinson's have Parkinson's for 10, 15, 20 plus years. So there are different stages that you may go through physically, emotionally, mentally, within your care partner relationship. So we're here to help along the way. We also have a We in PD series, just to kind of emphasize again that it really is a partnership of the care partner and the person with Parkinson's. That's not to say that everyone has a care partner, but there are educational series that can help, and that is coming up starting on Friday, January 15th for 5 Fridays in a row. So I know that Patricia is going to put up the information at the end. So anyone, please feel free to contact myself or anyone at Neuro Challenge, as well as Ginny, and hopefully we can offer you some support.
That's what we're here for.
Absolutely. And thank you both again. And if you or a loved one has Parkinson's disease, get information, get support, find resources that are available for you. I'm Patricia Henderson, and this is your Weekly Connection.